Hi everyone! Today I'll be going over Chapter 8 of our Drugs and Behavior textbook titled Medications for Mental Disorders, and I'll be going over the first quarter of the chapter, which is roughly pages 160 to 166. So first I'll be going over the medical model. So for mental disorders, behavioral symptoms are used to diagnose a disorder. For example, a person may be diagnosed as depressed if they are inactive, don't sleep or eat well, and don't say much. These behaviors are varied though and have many different causes, so it can be difficult to diagnose mental disorders. Psychoactive drugs can be effective at controlling symptoms, but not curing diseases. If chemicals can help normalize behavior, a natural assumption is that the original problem originated from a chemical imbalance in the brain. However, there is no direct evidence that a chemical imbalance causes mental disorders such as depression, schizophrenia, or anxiety. Next, I'll be talking about the classifications of mental disorders. So first, there are anxiety disorders. Some symptoms are chronic uneasiness, a fear of impending doom, and feelings of panic. Physical symptoms often activate the autonomic nervous system, such as flushed skin, gastrointestinal problems, increased heart rate, and shortness of breath. Obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, used to be included within this group. The next classification is psychosis, which is a major disturbance of normal intellectual and social function and a loss of contact with reality. An example of this is hearing voices that aren't there. There are organic psychoses, which have a known physical cause, such as having a brain tumor or high doses of certain drugs, such as cocaine. And then there are functional psychoses, which have no known or obvious physical cause. A person suffering from a chronic psychotic condition for which there's no known cause, that person will probably be diagnosed with schizophrenia. And then the last classification is mood disorders, which result in depressed or manic symptoms. Depression is an abnormally low mood, while mania is an abnormally high mood. Bipolar disorder is also known as manic depressive disorder, and is when at least one manic episode has occurred with periods of depression. Next, I'll be talking about the treatment of mental disorders before 1950. So in 1917, malaria therapy was used to treat general paresis, which is a syphilitic infection of the nervous system. They found that the fever associated with malaria often improved the condition. However, the later discovery of antibiotics eliminated this treatment. In 1920s, wealthy patients used narcosis therapy. This is when barbiturates and depressants were used to induce sleep for a week or more. Sedative drugs were also used in psychotherapy. A fast-acting barbiturate would be injected intravenously to relax a person and produce more talking during psychotherapy. Then in the 1930s, chemicals such as insulin were used to induce a coma or convulsions similar to epilepsy in order to treat schizophrenia. However, after issues with this method, electroconvulsive therapy or ECT was used. ECT was widely used in mental hospitals until the 1960s and is still used today for severely depressed patients who don't respond to medication. And then in the 1950s, paraldehyde was used, which is a sedative, and it was a major drug for mental patients at the time. And although it's safer than barbiturates, the drug has a really bad odor, and the drug made patients drowsy, so it was known as a chemical straitjacket.